Hello, let us learn the sternocleidomastoid muscle. So here in this picture you are seeing the sternocleidomastoid muscle here. Okay, from the name indicates it is sternocleidomastoid. Remember these 3 points. Okay, and starts from the origin. The muscle has got two heads. There is a sternal head and a clavicular head. Sternal head and clavicular head. So here we have the sternal head and this is the clavicular head. So this particular sternal head arises from the superolateral part of anterior aspect of manubrium sternum. So we are seeing the manubrium sternum. Okay, so the sternal head arises from the superolateral part of front of manubrium sternum. Okay, and it has got clavicular head here. Now the clavicular head arises from the clavicle. The clavicle. Okay, so here this clavicular head arises from the superior surface of medial two-third of clavicle. The clavicle is divided into medial two-third and lateral one-third. Okay, so medial two-third is quadrangular, so it's having superior surface, anterior surface, inferior surface and posterior surface. So this particular clavicular head arises from the superior aspect of the medial two-third of the clavicle. The sternal head is rounded and tendinous, whereas the clavicular head is fleshy and flat. Now the insertion. The muscle is, I told you, 3 points. We have the sternocleidomastoid. Okay, the muscle is inserted onto the mastoid process. Where exactly it is inserted onto the lateral aspect of mastoid process. Okay, so that is the origin and insertion of sternocleidomastoid. Now we know that this particular sternocleidomastoid is obliquely present on the side of the neck and divides the side of the neck into two triangles. You know that. So here we have the side of the neck. Okay, since obliquely present sternocleidomastoid divide the side of the neck into two triangles. Anteriorly we have the anterior triangle and posteriorly we have the posterior triangle. Now its nerve supply. It is supplied by the spinal accessory nerve. The root value is C2 and C3. Remember, it is supplied by the spinal accessory C2, C3. Now, what is the action of this muscle? Okay, when a single muscle contract, okay, so what happens? It tilts the head towards the same side. If the right sternocleidomastoid contract, okay, it tilts the head to the right side. And what happens when both the muscles contract? Okay, so when the right and left muscles contract together, it pulls the head forward. Now, what do you mean by torticollis or Wryneck? Torticollis or Wryneck. What happens if it is nothing but the spasm of the sternocleidomastoid? So what happened? This particular muscle contracts. Okay, it remains in a state of contraction. That condition is known as the torticollis. Okay, it's a clinical state where the head is bent to one side. Okay, head is bent to one side. So here you are seeing the sternocleidomastoid muscle. This is the anterior border of the muscle and here comes the posterior border of the muscle. Okay, just look at this diagram. You can see that middle of the posterior border of the sternocleidomastoid, there is a particular point through which four cutaneous nerves emerges. So we have lesser occipital nerve, greater auricular, transverse cervical nerve and the supraclavicle nerves. Okay, these four nerves emerges through a single point on the posterior border of the middle, of posterior border of sternocleidomastoid. So that particular point is known as the nerve point. That is the nerve point. What is the significance of this particular nerve point? Okay, so there is a procedure called cervical plexus block. Cervical plexus block. What is this procedure? In procedures like the surgery in the neck region, the anesthetist inserts the needle on this particular point. Okay, so the application of this anesthetic agent into this particular point, okay, anesthetize all the regions supplied by these all four nerves. Okay, so that particular procedure is known as a cervical plexus block. Cervical plexus block. And one thing you should remember, this particular procedure can also affect the phrenic nerve. It can sometimes it affects the phrenic nerve. Okay, so that is the nerve point and its clinical relevance.